Hello again, everyone. My name is Marty Guthmiller, and I'm CEO here at Orange City Area Health System. I'm joined today by Amy Van Gorp and Randy Sales, and I'll introduce those two more formally in just a moment. It's been over a month since we've talked about our COVID situation and given a COVID briefing. And we're here today to talk primarily about pharmacy services. But, old habits are hard to break. And so I did look at the coronavirus.iowa.gov website today. And so I thought I'd give a little bit of an update. But by nature of the fact that it's been over a month since we've talked about it, that should be a pretty good indication that things are heading in the right direction. And generally speaking, they are. And so here are a few stats that may be familiar to some of you. Sioux County, the 14-day average is 4.0%. A week ago, it was 3.6. So again, just normal fluctuations in that number. The 7-day average for Sioux County is 4.9%. A week ago was 4.5. So those are clearly way below the numbers that we used to be looking at. And then how they relate to Iowa. Iowa's 14-day average is 3.3%. A week ago, that was 3.6. And 7-day average is 2.9. And a week ago was 3.8. So the state as a whole is lower than Sioux County, but Sioux County a couple of weeks ago too was lower than the state. So that moves back and forth, and that is just going to fluctuate from time to time. In terms of Region 3 that we've used to talk about a lot, there are only 10 patients hospitalized in Region 3. However, 3 of those 10 are in the ICU, and 2 of those 3 are on a vent. So people are still getting sick, and the seriously ill are seriously ill, and we do have to remember that. Also to remember that COVID is still real. We did have 21 deaths again this week in the state. And so I say that only because we still have to pay attention to what's going on. Sioux County has remained unchanged for several weeks now in terms of the number of deaths, and that remains at 74. Some of the things that we're getting questioned on today are the testing and how do we get tests, and usually those are connected with traveling. And here's what our team has recommended for that. First of all, our Test Iowa site is still open Monday through Friday from 8 in the morning until 9. That is a walk-in clinic, so feel free to do that. That's located in the Ock Health Department in MB1 on the far west part of our campus. So we would encourage that. The next tier is in our clinic appointment scheduling, and you can do that. And I should also mention that the Test Iowa site is the PCR test. That's kind of the, I guess you could say, gold standard. It's tough for anybody to demand more than that because that is kind of the big test, so to speak. The rapid test is available in the clinic, as would be the PCR. And then the third level is in our walk-in clinic. So you can feel free to check one of those 3 places. And then also we're encouraging the community and Iowans to continue to get vaccinated. That's critically important as we go through. Last week, as an example, it slowed way down here at the health system, but we did 25 new patients last week. And so that's 25 more, but certainly less than the several hundred each week that we were doing. Maybe you find this interesting, maybe you won't, but Iowa has administered about 86% of the vaccine supplied by the federal government. So that sounds like a pretty good number. But what that represents actually, and that's number 7 in the US, so Iowa does a pretty good job of that. But what that represents is only 41% of our population. And so less than half of Iowans are vaccinated at this point. And number 1, by the way, in the United States is Maine at 49%. So there really isn't any state in the country that's over 50% vaccinated at this point. Some of you may be wondering about the 12 to 16-year-old vaccination process. And that's mostly going to evolve over the summer relative to the health system. If some of you are really interested in that right now, and maybe Amy and Randy can talk about that a little bit too, But right now, Pfizer is the only option in that area, and Hy-Vee and Sioux Center, or any Hy-Vee probably, can offer that. Currently, we are not holders of the Pfizer vaccine, and so as it stands right now, we don't know. But we're thinking maybe this fall there might be more of a push for that, and so we are investigating the ultra cold freezers and that kind of thing. But for right now, Hy-Vee is an option if you're interested. Otherwise, probably you can anticipate some process with back to school physicals, perhaps, where the Pfizer vaccine can be made available. But we're not here to talk about COVID-19 today. We're here to talk about clinical pharmacy. And most of our audience today is not aware of the fact that we really have three primary pharmacy services here at Orange City Area Health System. And the first and perhaps most obvious is the what we call the more behind the scene pharmacy services. And those are pharmacy services that are provided to all inpatients. Our medications administered through the emergency room, our infusion lab, places like that. And so that's a significant service that we provide, but largely behind the scenes. Most of you wouldn't know where the inpatient pharmacy is. That's because we don't want people in our inpatient pharmacy. It's kind of hidden, and that's for a reason, and that's largely behind the scenes. The second area of pharmacy that we provide is our retail pharmacy, and there's probably more familiarity with that, Orange City Area Pharmacy. And that's meant to be convenient to our patients. For both those who are in our clinic, those who are discharged from the hospital, from our birth center, from our surgical center, or even our ER during certain hours. And so those are not only able to be filled conveniently prior to patients leaving the hospital, but also in their refills. That's a possibility. And one of the things to remember, if you do have the MyChart application, you're able to get your refills through that MyChart application to Orange City Area Pharmacy, and that's something to remember as well. That pharmacy is located just down from the gift shop. So if you're in the front lobby area, turn by our gift shop, and it's just about halfway down that hallway. If you get to our emergency room, you're too far, but that is an option for you as well. Now, our clinical pharmacist, and really the primary topic of today, is these two offer a service that is kind of unique for a rural hospital. And as such, I thought it important that we explain what these two professionals bring to our organization. They are located in the Orange City Family Medicine Clinic, but serve in a variety of ways throughout our health system. And so let's get to know them a little bit. As I mentioned earlier, we have Amy Van Gorp. Amy, you want to give a wave? There you go. And Randy Sales. Randy and Amy have joined us, and they'll talk about how long and all that kind of stuff. But I'd like to first ask you guys to start out by giving you a little bit of background on who you are. Where did you grow up? How many children you have and cats and things like that. And then, but also the primary thing is, what kind of background, what kind of training does a clinical pharmacist have? So Amy, you want to go first?
Sure. So Amy Van Gorp, I actually grew up in Sioux Center, so I'm from Northwest Iowa and familiar with the area. I'm married and have 3 girls, and recently got a puppy, so we have a 4th baby. Training for me, I went to pharmacy school, and Randy did too. We both went to pharmacy school to get our doctorates in pharmacy. So our degree is a PharmD. I went to the best pharmacy school, University of Iowa. Go Hawks. Randy went to SCSU.
Yeah.
So she can introduce herself.
Yeah. I'm Randy Sales. I was formerly Sandbolt, if anyone knows that name. I originally grew up in the Carmel area, and then moved to Alcester just over the border. But still go to church in Carmel, so have some Northwest Iowa ties. Really like working in this area. small town is kind of what I like. So it's been great to be here and see some of those familiar faces and names. Same thing with Amy. I went and got a doctorate of pharmacy from the best college, SDSU in Brookings. We have a friendly rivalry here. So I went to SDSU. That's a 6-year program. And then after the program, I did a residency. Amy did as well. My residency was in Sioux City. And then after residency, I became board certified in ambulatory care pharmacy. So ambulatory care pharmacy is kind of working in the clinic like we're doing and helping people with chronic disease states, which we'll kind of touch on what we do with that.
And everything we do after pharmacy school is optional. And Randy and I both wanted to work in a clinic setting, so we needed to do that kind of training to work in a setting like this. So residency and board certification is what we did so that we could really help the patients in a clinic setting.
So that's a good segue. Your offices are in the family medicine clinic. So talk to us about how you work with the family medicine providers in terms of medication consultants. How does that work? Can you just talk through that a little bit?
Yeah, so our office, we're actually sitting in our office right now. We are kind of centrally located in the clinic in Orange City to help any patients in Orange City, but also we connect quite frequently with the Mill Creek clinics and hospice clinics as well. So how do patients get to us? Essentially, a lot of providers will just either stop by our door and say, hey, so-and-so needs help with this condition, can you help them? Or they need help with the cost of this medication, can you help them? They'll either stop by or they'll send us a note, or they'll give the patient our information and the patient will call us. Patients can feel free to call us as well. We're here to help with any sort of medication related need. As long as the patient is established and has an Orange City area provider, we can help work with them. We're here Monday through Friday, so really available any weekday to patients if they need us.
You talked a little bit about helping people with cost. Could you talk through that? Because I've heard some stories about you guys are pretty good coupon cutters and things like that. Could you kind of talk
we're living up to our Dutch heritage.
Yeah, there you go. All right. Could you talk a little bit about the cost side of the equation, what you provide to help people out there?
Yeah, and I think it's universal. Insurance is frustrating, especially prescription insurance, and navigating plans that change their formularies every year, and then changing deductibles and changing these things called prior auths that you need in order to get medicines. So yeah, every year, I mean, we're helping patients if they have trouble and getting stuck with those, then we kind of look up their plans, see what's covered, help find hopefully an alternative that is more affordable that they can take. So it's a lot of research, but you need it to get the medicine. If you can't afford it, you're not going to take it. So we got to help you get the medicine that you need.
Good.
And when we look at like outcomes, we want patients with diabetes to have the best control, but they're not going to have the best control if they can't take their medicine. So that's where pharmacists can play a role in making sure they get the right meds at a cost that they can afford to hopefully have the best outcomes.
Great. Yeah, if you can't afford it, you can't use it. So that makes sense. Appreciate that. So, there's a lot of behavioral health issues and probably even more so now with COVID. Do you guys have a role in behavioral health medications and in the things you see in the clinic?
Yeah, I think behavioral health is complex and the medicines are hard. So we work as a team. We work with Dr. Domlin, our on-site psychologist, and then all of our providers too, just to try to figure out really a good strategy and regimen for patients. Probably the area that we have the most expertise in is like the pharmacogenomic testing. So we work with a company called GeneSight, and we do genetic testing for mood medications. And it will show us for a specific person, which medicines are the best option for them. Helps us to avoid trying and failing a bunch of medicines that are not going to work for them. So that's been, helpful to get those results and help people at least tailor it toward ones that we would expect to work well for them.
Well, hopefully better clinically, but also better financially because you're hitting the mark earlier.
Yep.
You mentioned the management of behavioral health, but generally speaking, medication management. Could you explain your role in that?
Yeah, so I would say, and butt in anytime, but for me, like, this is one of my favorite parts of being a clinical pharmacist, is helping patients find the right medicine for them. So our providers will help diagnose conditions, diseases, and then we can come in and really find what's going to work best. And I'm always looking at what is effective, what's safe, and how much it costs. Those three things. So I will really look at that person, look at your lab work, look at your other medicines you're on, and find what should work best for you and what you're going to be able to tolerate. So in general, that's what med management is for us. And then also helping people who, like, we call it deprescribing. So getting people off of medicines they don't need, trying to make this med list as simple as we can. Every medicine has a side effect. And a lot of times we have people who get put on a medicine to treat the side effect of another medicine, and it just snowballs. So we try to go in and help really pare that down to what is only needed, and hopefully help people feel a lot better on that.
Good, thanks. Randy, I know you serve on our antibiotic stewardship team, and one of the things that I talk about is the depth of medicine that's practiced really anywhere, but I'm obviously most concerned about Orange City Area Health System. And I think one of the things that you guys have added to our system is a depth of medicine, our ability to practice, to dive a little deeper into things. And some of the things that you talked about are, it's clearly evident that. But on the antibiotic stewardship team, can you talk a little bit about what's going on with that and why do we care?
Yeah, I think with COVID happening, this is a good example of why we care that we use the meds correctly. So we have meds that work if someone's sick. So antibiotic stewardship is definitely a hot topic. The last couple of years, making sure we use the right medications at the right time when people come in if they're not feeling well. For a long time, we practiced, if people aren't feeling well, what's the harm of giving an antibiotic? If anything, they'll get better, but is there really any danger? But what we're finding is that, yeah, there is the potential danger. There is potential side effects and resistance. And that's a huge global danger to us. If we don't have meds that work against the bugs that are causing these infections, it can cause quite a few illnesses. So with antibiotic stewardship, what we do is we meet as a team. There's, not just myself, but there's leadership and pharmacy and nursing, quality. We all meet quarterly to look at the antibiotics that we're using both in the hospital as well as on the outpatient side. Are we using them correctly compared to other facilities? Are we using them more? Are we using them less? Are we using them for the right indications? Just kind of really diving in deep to make sure that the meds that we're giving are appropriate for the conditions we're treating. And we also will trend like resistance rates. So we can look at resistance to organisms specifically at Orange City Area Health System and make sure that the antibiotics that we're using actually work for the bugs that we're treating in our area. So it's a very interesting thing for me to look at. I like to watch those sorts of things, but it's definitely an important thing that make sure we're using the right medications and not overusing them and causing harm.
Yeah, and from my perspective as a non-clinical person, it's very interesting to kind of see. You don't want to go with the biggest gun right away. You want to use the smallest gun if you're going to use a gun at all. And of course, sometimes that puts all of us in a tough, mostly the clinicians, in a tough position sometimes when antibiotics are not called for and not required. But there are some serious consequences, as you mentioned, to being too liberal with that. And it's good for me to see as a non-clinician, again, some of the impacts of that. So I appreciate that.
Yeah.
We've talked a lot about folks in the clinic and the roles of different people throughout the organization, but I know you guys are involved in senior care. And could you talk a little bit about how you've interjected your profession into senior care and kind of what that's done for us?
Yeah, I can kind of touch on that a little bit. So our senior care campus, PRCC, is kind of our nursing home facility. And one of the federal regulations is that every patient has to have their medications reviewed monthly by a pharmacist. And when Amy and I started, one of the things we did is we tried to make that pharmacist a local pharmacist that works with our providers on a daily basis. And that just is a nice communication for us that we can, it's somebody that we might eat lunch with or someone that we see every day that we can say, hey, these meds, we see a concern here. This is what we recommend. So we'll review them at least monthly. If something comes up in between then, we'll do it more frequently. If they're in the hospital and they need a med review when they get back to the nursing home, we'll do that. We're available for families as well. So sometimes we'll call families and say, we've noticed these things. What are your thoughts and how can we improve your loved ones' quality of life when they're in the nursing home? So involving families, we'll also work pretty closely with the nursing staff out there. They're with them every day so they can see them and report back to us if there's any sort of medication side effects or concerns. We can kind of be a bridge from them to the provider if we need to discuss things with the physician that rounds on them. So, yeah.
I think one of the things you mentioned is sometimes we overlook this is the familiarity with the patient and maybe even the familiarity with the family. And again, from what I've observed, it's not just a clinical interaction, but there's also a financial element to this that, we want people to live out their lives in the best way forward. And sometimes it's with fewer meds, and sometimes there's financial burdens and things like that. And, let's try to put things together and let's have the best course that we can. And sometimes you don't know that unless you're familiar with what's going on around that. So thank you guys for doing that. I have one more question before I just throw it open to see if you guys have anything to add, but we kind of skipped over this a little bit, and that is the role that you guys play in all the patients that are discharged from the hospital. Whether that's from the birth center or not necessarily even the hospital, from our surgical center. And but I know you talk with or consult with every discharge that we've had. And do you have any stories or anything that you can tell about that, or particularly, I know there's been some successes in that, but if you found that to be helpful, if patients found that to be helpful?
Yeah, I think so. I mean, we are really, looking at every patient that gets discharged. We're looking at their medication list and looking especially at new medicines and making sure it's a good choice and they'll be able to afford it. So I think we do. We pick up on things like a medicine that's just not going to be covered. We have to find the one that will be covered and make sure they get it timely. And then also, I think finding medicines that is going to interact with something else they're on and fixing that before they leave. And then we find that out later. Yeah. So I think we've caught some things like that. I don't know if you have any other.
Yeah, I can think of like one story. And this happens more often than you think, is that our goal is to review those medications and make sure they're appropriate, but also try to prevent them from having to come back to the hospital a week later. Our goal is to get them healthy enough to go home and stay home and be comfortable at home. And what we found on some of our medication discharges is that, for example, we had someone that was admitted with hypertensive emergency. Their blood pressure was very high, very concerning. We got them controlled and we went to order the meds, and they use a mail order pharmacy usually. Well, that's not super helpful if your mail order pharmacy doesn't get you your meds within 7 days. So just catching those things to make sure that when they leave that day, they're going to have the meds that we were giving them. Otherwise, they're going to end up right back with us again with the same condition.
And again, a lot of the same things, sometimes I'm sure, I know we found that people don't understand, in some cases, particularly if it's a new medication, and they don't always want to say that. Some people can't afford it. And again, they don't always want to say that. And so the opportunity for you guys to meet with them, talk with them, make sure that they do understand and take those medications is really important, because as you hit, we would just assume that they are not back here in the hospital, and they would just as soon not be back here in the hospital. And everything that we can do to prevent that is what we try to do. So you add another layer of protection in that. Okay, so I'm through with my questions for the day, and I promised you I would let you throw some things out there if you have any, or if there's something I missed, or if you had anything else that you wanted to add. Amy, you could go first.
Okay, I think I would just add one thing, and I know everyone's sick of hearing about it, but this past year facing COVID has been very interesting for us. And what we've done is really looked at taking a disease with no known treatments, and then now getting all this data and evidence just coming out all the time. What we've done is reviewed that and then given it to our doctors so that they can make good decisions on what treatments are we actually going to use or not. And I think by doing that process, we were able to offer some COVID treatments here before even some of the larger health systems in our area. So I think that's a real credit to our health system that we could do that. So it definitely has kept us on our toes the past year looking at all this stuff. So, yeah.
Good, thanks. Randy,
I would
anything?
just say, we're always here to help any sort of patient, whatever medication needs that are out there, we want to help them. And a lot of times it's working in the background. It might not be something that you always see on paper, but it might be working on a prior auth for a couple hours while the doctors are seeing that patient. Or a project that our physicians need us to work on so they can keep seeing their patients. So sometimes it's a lot of background work that we try to help with, whether it's patient driven or provider driven. We just try to be there as a resource to them.
Well, thank you guys. I mean, we really appreciate you being part of our health system and what you've done, not just for patients, but for all of us. And we greatly appreciate that. And I do believe that you've added to the depth of medicine practiced here at Orange City Area Health System. So one thing that maybe we didn't mention is, if somebody really would like to talk with one of you, how do they do that? Do you have to go through the clinic provider, or how do they do that?
Really, they can call the clinic. We've had people do that. They've heard a friend of a friend had help, or whatever that may be. If they just call the clinic and say they want to meet with a clinical pharmacist, we can get them scheduled. We typically do schedule our appointments just to respect our patients' time. So when we're with them, they get all of our attention. But yeah, they can call and schedule that whenever they'd like.
Okay.
Yeah, just the clinic number.
737-2000 and ask to speak with one of the clinical pharmacists.
Yep.
There you go.
Yeah. All right. Well, thank you guys for joining us. We really appreciate it. And thanks again for what you do for Orange City Area Health System.
Yeah, thanks for having us.
Yeah.
All right. Thanks.
Yeah.